So I always like to start my presentations with a little bit of overview of where we're going and what we'll talk about. So I will talk about the structure of kind of how PERC and TQIP fit together. And then I'll talk about what our services are. And when I say our, kind of throughout all this, I'm talking about PERC, which is the Program Evaluation Research Center. And we do social science related research and evaluation. From the beginning conceptualization of it, we help people with that, all the way through all the phases of data collection, all the implementation pieces, analysis, reporting, and then thinking about how to recycle that into the next project. And so when I get to talk about that, I'll split it up the way OSP splits it up. We'll talk about pre-award kinds of services and post-award kind of services.
What's OSP?
OSP is Office-Sponsored Projects. So at the university, it's the group that kind of helps us get funding proposals through and then implement funding once it shows up. And then the last bit, if we have some time, I thought I'd talk to you about some of the tools that we tend to use. They're familiar tools to many of you, at least in terms of the terms there, but we use them in a little bit innovative, novel way. So I'll talk a little bit about that as well. So who are we? What is our structure? TQIP is this big name that I kind of got saddled with. I didn't name it, but it is the evaluation entity, essentially, for the CTSI. And the largest part of what we do through that is a logic modeling process that helps each of the cores figure out exactly what their goals are, what the activities are that they're doing to meet those goals, and to keep track of that and to collect information related to it. And I'll talk more about collaborative logic modeling before it begins. But so TQIP is housed within PERC, within the Program Evaluation Research Center, which I direct in the College of Education and Human Services. So that's a completely different entity within WVU than the Health Sciences Center. That allows us to have a little more external perspective, novel perspective on things. So I just sort of laid out who the people are. I direct sort of both. Luke, who's here, Luke Moore, kind of does the day-to-day. He's 100% on TQIP. And then we've got a few graduate students that are 4 graduate students sort of split across the 2 groups. For an evaluation center housed in the College of Education, you would expect us to do kind of all this stuff over here. You know, we do a lot of helping faculty in my college with proposal preparation, with implementation of the evaluation and applied research parts of their proposals. We've helped Bluefield State College with a Department of Ed innovation grant proposal. We have a couple funded projects with Education Alliance, which is a nonprofit out of Charleston. And we are newly starting some really interesting collaborative work with University of California in Santa Barbara, which I'm having a lot of fun with. But besides the more educational-oriented things, we work with and support people in several other colleges at the university as well as beyond. So the CTSI is an obvious piece, but we also helped with the development of the Prevention Research Center proposal that just went into the CDC, doing the evaluation for them. And then we have several projects with the Statler College, that's the College of Engineering and Mineral Resources at WVU. I've only listed the 2 funded ones, but we also have probably 8 or more proposals that we've helped them develop over the last couple of years. We're working with Eberly on another STEP grant. This one, this Engineers of Tomorrow, is a STEP grant. It's a STEM talent enhancement program. And so it's sort of like an infrastructure type grant. It's similar to CTSI in some ways, but it's more about getting more STEM professionals out there rather than translational science the way we work here. We've done some work with the faculty in the law school, as well as supporting some people at WVU Tech who are going after NSF funds. So you can see we work across a diverse range of content areas, lots of different types of collaborators, lots of different types of external funders. So we've developed a fair amount of experience. So this is the way that I've divvied up talking about what we do to help folks. So it's pre-award on this side, so these are all the things that would happen while you're trying to get money, right? Post-award on this side, this is what you do after you actually have the money, and oh no, now I have to do what I said I was going to do, right? So we, because of the large, diverse group of people that we've worked with in the past, can often be very helpful in forming collaborative teams and figuring out, you know you need this kind of person, we may help you figure out where you can find that kind of person. Our evaluation skills allow us to often be very helpful in fine-tuning what the goals and objectives are for a program, so that you can think through very carefully how are you actually going to measure that, right? So we do a lot of front-end design stuff. One of the things I really like about the model that we use is, you know, as an evaluator, you often get called in after something is funded. And then you're sort of handed, here's what we said we would do, help us do that. But instead in PERC, we really almost always get involved with people in the design stage, so we help design and write the evaluation section of the proposal, so that if it gets funded, if and when it gets funded, we're doing work that we wanted to do, right, that we set up. And we don't charge for any of the proposal preparation kind of stuff. Now, we're not a large shop, you saw the personnel earlier, so we have to be a little bit targeted in how much we can take on. So we have to kind of make some decisions about what is likely to get funded, right? Not ever an easy choice, but within that, unless it is, have been some cases where there's funding available for pre-proposal work, but for most cases we don't charge for pre-proposal work. It's really just, we want to help you write the best proposal you can, so it's most likely to get funded, with the understanding that if it does get funded, we will do that evaluation work that's written into that, and that's on the back end where we get our kickback.
Is that usually is percent effort, Reagan, or is that?
Yeah, it kind of depends on where you're proposing to, but for most of them it's percent effort. So it's usually some amount of faculty time, maybe myself, maybe Lucas, maybe, actually we've got 15 or 20 faculty affiliates that work with us, that when we get something funded and we don't already have, if they weren't involved at the proposal writing stage, we go to them and say, hey, do you want to get on this, can you do this, right? So it's faculty time, it's graduate student time, and then, you know, the little miscellaneous things that always have to go in, like travel and office supplies, depending on the scope of the project. Sometimes it's participant support and different sorts of things. But mostly it's time of people. So I'll talk a little bit about logic models and program theory and concept mapping a little bit more, but these are techniques that can be used both in the planning stage of projects to fine-tune and focus in what you're going to do, and also then later, once you're funded, you can use them for evaluative processes as well. So once funding shows up, then we can help in figuring out how do you actually operationalize what you said you're going to do. So, for example, the CTR award, the proposal says we're going to use a collaborative logic modeling process that's going to build evaluation capacity in the course. And what's actually in the proposal is this very generic logic model that says there are inputs, there are activities, and there are goals, and that's all that's there, right? So we had to actually figure out, and that's what we've done over this past year, very detailed specific logic models for each core individually, as well as one that brings them all together. And we did all that working closely with the core personnel so that they had lots of input, and actually going forward they continue to have input and revisions to those models. And those models then help us define what should we be measuring, and then that is from that we create quarterly reporting structures that bring the data back in that we work with, right? So that kind of operationalization at a very detailed level is what has to happen once you have the money. And it's often not there in the proposal stage, because you don't have that kind of space, right, to write about it. So all that's part of metric development, figuring out how you're going to collect the data, where you're going to store it, how you're going to store it, how you're going to analyze it, actually doing the analyses, figuring out how to feed that information back into the project so that, one, it is helping you make database decisions about how to get better at doing what you're doing, decisions about which things should you keep doing, which things should you maybe not do anymore because it's not helping that much, right? But then also helping you feed back to your funder, hey, look at this, you should keep sending us more money because we're doing a great job, right? So that's the formative and the summative side of things. And then it also really should be feeding into the next cycle, right? Just as a lot of the focus at this retreat is getting ready to propose for a CTSA. For almost any funded project, some of the focus along the way needs to be, okay, where are we going to go next with this? How are we going to position ourselves well to pursue something else that follows on? So that's a layout of our services mapping. Now you've probably heard about concept mapping as just a way to visualize knowledge and how it's related to each other. That general way of using concept mapping is not really what we're talking about here. This is a much more specific structured methodology. It's actually developed by Kane and Trump, for those of you who like academic citations. But it involves getting, I'll give you an example. We use this to help design a program for a statewide program for colorectal screening, cancer screening in West Virginia, so that that group could go after funding to try to create that sort of program. So they got together a large group of doctors, nurses, healthcare professionals who specialize in cancer, and brought them together and asked them, what are the components that should be part of a statewide screening program for underserved people in the state? And so that group came up with a fairly long list. It was like 80 different components. And then with that group, then once we sort of fine-tune those statements to have them be 80 unique statements that were relative to parts of this component, we had them group them together. And that's where this methodology then allows us to get a consensus sort of grouping. So here's a bunch of elements that are all related to patient navigation or those sorts of things. Here's a bunch of elements that are related to resources that are needed. Here's elements that are related to getting the word out, communication, those sorts of things. And then we have them rate those in various ways. So here's just to kind of help you visualize this a little better. But what it does is it gives you sort of a consensus grouping of those elements. So you can say all these things are stakeholders who really knew the details and had the expertise in this area said these things went together, right? And then for that cluster of things, we can say, well, let's also ask them to tell us how hard would it be to really do that, and how important is it to do that for this kind of program. And so then we can graphically say, well, these kinds of things, if maybe this was patient navigation, these kinds of things were very important to do and not that hard to do, so we really need to include that, right? Things down here that are less important and more difficult, we probably don't need to worry about, right? Things that are difficult and important, we probably need to figure out how to do, but we know they'll take more resources, right? So this methodology is really helpful for putting together a expert, stakeholder-driven consensus as to what a program should be formed around and how it should be put together. So that's one example of one of the kinds of things we could do. I mentioned...
Would you call this at the level of the logic model of the inputs?
I would call it needs assessment.
Well, that's what I mean by
Yeah.
inputs, but is the needs assessment.
So I talked a little bit about logic modeling the way we tend to do it. If you've ever been involved with CDC-funded research, for instance, you're familiar with logic models. And there are several other funders that use them fairly commonly. Most often, though, they're used in the way that at the proposal stage, you have a detailed logic model. And when you're funded, you're expected to stick to that exact logic model all the way through. So it's a static structure that has to be adhered to. And evaluation is about how well you adhere to it and how well the metrics show that you make the progress you're supposed to. We use it in a bit different way than that. We use it as a more collaborative process where we work with the personnel in the program to help them understand the conceptual reasons that logic models make sense, right? They help you lay out the the theory of why a program is supposed to work and help you identify places that you can collect information to see if it's doing what it's supposed to be doing in terms of, are these activities really happening? If they are happening, are these outcomes that you think will come out of them, are those happening? And are they leading to the other things that we expect to happen? So the way we use it, it's a collaborative process, and those models get changed and they morph over time as a program changes over time. Because I've not ever worked with a program that was worth much of anything that didn't change over time, right? As the reality changes, the program needs to change to react to that reality. So we use it in a bit different process. It does end up creating what at first looks like a big mess. So this is one small piece of the admin logic model for the CTSI. This is just specific aim 1. And no, I don't expect you to read all this detail. I just want to give you some idea of what these are. So this whole model would have 2 more large chunks below, and it would go a bit farther that way as well. But the basic idea is that we figure out what are the resources we have to work with. What, in some sense, you can sort of start here and work your way back. Over in the long-term goals are what do we want to accomplish at the end of this whole project? What do we hope we're going to meet? So it's infrastructure that will support increased clinical and translational research, and it's clinical and translational research that actually makes health impact changes, at least at the state level, if not larger. Right? So working back from that, you can figure out, well, what would we need to do to get there, and what are the more immediate 1 to 3 year kind of goals that we need to do to get there, right? And then what are our actual activities? What are we doing? How can we see if we're doing that or not? And then, if this is happening, it should be impacting a particular short-term goal. So we can look at a structure like this, and the metrics aren't on here, but we can, for each of these boxes, figure out what kind of information do we need to collect to see if that's happening, to measure that, right? So we collect that information, we track it across time, and we see what happens.
That we just completed a grant application, and so not only would it have been a good idea, but you know, too late, I'm just finding out about it now. But on the application, besides your narrative and your specific aims and your plan and on your budget, and all, then there was this other form, which I wish I'd met you, you know, and heard about this 2 months ago. And there was a form that looked just like this. And you were supposed to list your goals over here, and then they said, what are your primary drivers? Like, how are you getting there? Like, we were going to do great research in West Virginia. So then, what are your primary drivers? Well, we better get some researchers, and we better have an education program. Well, how are we going to do that? Well, we better find some teachers that are going to, in other words...
Yeah, I mean, that sounds just like this.
It sounds just like this. But I mean, it wasn't like this was a little added thing we were going to throw into our narrative. This was a form that you had to complete, you know, Form X1A, you know, or whatever it was.
What funder were you proposing?
This was the CMS Innovation 2 Awards program. And that form was right on there. So those of you who think we might skip this, actually, you might be filling it out one day.
It comes out of the Institute for Healthcare Improvement. The Berwickian model, it's one of the Berwickian models that they use at the Institute for Healthcare Improvement, where you have your problem, and then you have your primary drivers and your secondary drivers that lead to your goals that you want to achieve. So that's where they've gotten this from.
Yeah, it's just a slightly different terminology to talk about the same kind of thing. And that's, I mean, you said it sounds like Greek, and that's exactly what the reason you might want to evaluate, really. Because most people who sort of work in these fields, who work in programs, who are doing good work, don't think in evaluation terminology. Now, it will make sense to you when someone explains it to you and walks you through it, but you don't naturally think that way, and we do, right? And that's a big part of what we do. Ideally, early on in the stage of program development and putting a proposal together, sit down with you and talk through what are your goals? How are you conceptualizing your primary and secondary drivers, or whatever terminology you're using? And then help you think through, okay, how would you actually measure that? Do we need to maybe restate it a little bit, reformulate it somewhat to make it more easily measurable, so that you can capture and track information related to that, so that you'll be able to prove to the world the wonderful work that you're doing. And that you'll be able to look at that information that you're tracking to think about, how might we, you know, okay, this doesn't seem to be doing what we thought it was going to be doing, so how might we change it up to make it more effective? And that, those two things, that is summative and formative evaluation right there. It's proving to the world, summative, formative is making things better based on the information that you're collecting. So that's, you know, that's what we try to help people do. And, you know, there's sort of an interesting sort of dialectic going on among funders that at the same time they're saying evaluation is more and more important and it's more and more required and more funding applications. They're also limiting the amount of funding they're willing to put towards evaluation. But you know, this is, you know, do more with less is something I think we're all quite familiar with, regardless of what field we're in. Yeah, one of the other things we do as a TQIP core is try to figure out for some of the cores at least, are there useful sort of targeted specific evaluation projects that we can do for them. So like we're doing a concept mapping project for community engagement with Dana and with the PBRA. We're building towards that to help them figure out what their priorities should be based on input from their stakeholders, the people who come to this PBRA retreat that they're having coming up. So things like that. And so there's a possibility there that we may find something like that that would be useful to one or another partner site as well.
We're doing a project with HISTA.
We're doing one with HISTA as well right now.
I've proposed to Reagan that we do a social network analysis and collaboration among CES members. So we can start to do that yearly or bi-yearly.
Yeah, we're definitely moving in that direction. We just
Especially since that was on
Yeah,
the things, the areas that needed to
yeah,
be
we just
developed for the
bought,
next one, right?
That was a good spot.
I just bought Luke a new book, so he's the expert.
Okay, well, we're trying to
We're out of
get,
time.
we're trying to get right on 15 minutes behind schedule, so
Thank you for
thanks.
coming. Thank you for your questions.
Thank you, Ray.